Welcome to Hitting the Bullseye, the podcast dedicated to exploring every facet of Lyme disease. Today we're joined by our fourth survivor, Keith, Doctor of Public Health Alexa, and Dr. Stephanie. I hope you are all enjoying today's podcast in the fresh air as we discuss the impacts of human behavior and the American healthcare system on Lyme disease.
Now, I love a beautiful hike just as much as the next person. Enjoying the peace of nature in the springtime. There's nothing better.
And while I don't want to be the bearer of bad news, unfortunately, getting outdoors comes with risks.
That's right. It takes just one bite from a black-legged tick to be infected with Lyme disease, a bacterial infection that can be treated and cured with antibiotics when it is caught early.
These ticks are most likely to be found in the northeastern United States, but beware of exposure anywhere that ticks might be.
Unfortunately, I would know. I had Lyme disease 5 years ago. Once bitten, it is critical to remove the tick cautiously and seek medical care. I didn't think it was all that serious at the time, though.
Wow, that sure sounds scary. Keith, share more with us about your experience.
I didn't seek immediate medical treatment after I was bitten. Because of that, a disease that I understand could have been easily treated turned into a diagnosis of post-treatment Lyme disease syndrome, or PTLDS. I have debilitating symptoms of PTLDS that lasted for 6 months, and sometimes I still experience symptoms today.
Well, preventing disease development is key, and we can all play a role in getting educated on early recognition of Lyme disease and when to seek treatment. That's why you are all here today. Lyme disease research is continuously evolving as scientists better understand how the disease enters humans and affects health.
However, there's more to Lyme disease than just the medicine that cures it. Researchers in the fields of medicine and public health want to understand the in-between time of getting infected and getting treatment.
The longer Lyme disease is in the body without proper diagnosis and treatment can seriously affect one's quality of life. So Anne-Marie Hirsch and her research team conducted a study using Pennsylvania health data from 2015 to 2017 to identify patients who had received a diagnosis of Lyme disease and were prescribed antibiotics afterwards.
Those patients received questionnaires to assess how long it would take patients infected with Lyme disease to access medical care, called time to first medical contact, and how long it took to get treatment after contact with a doctor.
There's a common experience that even after making contact with a medical professional, getting treatment is not as easy as it seems. After I was bitten and started experiencing symptoms, I knew I had to seek treatment. But after I spent months seeing multiple doctors who refused to diagnose me, all because my ever expanding rash was not a perfect bullseye.
It is true, the symptoms of Lyme disease are not consistent. Even the most telltale bullseye's rash does not always present as a bullseye. If the most classic symptom of Lyme disease is so easy to miss, how can we address that?
Educating communities can be really tough to accomplish, as Dr. Alexa would agree. It is really essential to get patients to seek care as soon as they think something is wrong with their bodies. Even further, we need to educate our medical professionals on what we call Lyme literacy. Our patients' concerns cannot be dismissed just because their disease presentation does not fit textbook standards.
Oh yes, I definitely agree. So in this study, about 31% of participants waited over 30 days from the onset of symptoms to seek care, and those individuals were more than twice as likely to develop PTLDS. Only 56% of participants were able to receive their diagnosis of Lyme disease at their first doctor's appointment.
Now I know the American healthcare system is expensive and hard to navigate. Access to healthcare, including insurance coverage and local trusted doctors, can impact Lyme prognosis in anyone.
This knowledge brings us one step closer to preventing PTLDS because knowing the barriers to prompt treatment allows public health and medical professionals to make changes to the system that will decrease the amount of time between infection and medical care through education.
Well, it seems clear to me that new discoveries will continue to emerge and that our protections against Lyme disease will only continue to get stronger. I'm so glad to not be afraid anymore and to be a part of a group that is helping to build Lyme disease literacy in our communities. So cover up, get outdoors, and have fun.
Thank you, Keith, Dr. Stephanie, and Dr. Alexa for helping us understand the complexities of this disease, human behavior, and medical practices. To our listeners, we hope this conversation gave you some insight into the fascinating world of healthy habits and disease prevention. Stay tuned to Hitting the Bullseye for more stories of innovation that could transform the way we think about medicine. Thanks for listening.